Tumors of the adipose tissue. Lipomas are benign and liposarcomas are malignant common examples of adipose tissue tumors. Other uncommon variety of adipose tissues include hibernoma, where the tumor arises from brown fat, lipoblastoma, these are fetal lipomas which are found in children. The first one is lipoma. Lipoma is the commonest soft tissue tumor. It appears as a solitary, soft, movable, and painless mass which remains stationary or grows slowly. Lipomas occur in the 4th to the 5th decade of life and are frequent in females. Location of lipomas: subcutaneous tissue in the neck, back, and shoulder. A lipoma may rarely transform into liposarcoma. A variety of lipoma with other tissue components include fibrolipoma, which is a combination with fibrous tissue, angiolipoma, which combines with bone marrow elements. Infrequently, benign lipoma may infiltrate the striated muscle. Spindle cell lipoma and pleomorphic lipoma are unusual variants of lipoma. Grossly, subcutaneous lipoma is usually round, small, oval, and encapsulated mass. The cut surface is soft, lobulated, yellowish orange, and greasy. Histologically, the tumor is composed of lobules of mature adipose cells separated by delicate fibrous septa. A thin fibrous capsule surrounds the tumor. Liposarcoma. Liposarcoma arises from primitive mesenchymal cells, the lipoblasts. It occurs in the 5th to the 7th decade of life. Liposarcomas occur in deep tissues. Frequent sites include intermuscular regions of the thigh, buttocks, and retroperitoneum. The prognosis of liposarcoma depends upon the location and the histologic type. Well differentiated and myxoid varieties have excellent prognosis, while pleomorphic have poorer prognosis. The round cell and pleomorphic variants metastasis frequently to the lungs, visceral organs, and the serosal surfaces. Grossly, liposarcoma appears as a nodular mass 5 cm or more in diameter. The tumor is circumscribed but infiltrative. The cut surface is grayish-white to yellow, myxoid, and gelatinous. The retroperitoneal masses are much larger. Histologically, the hallmark for diagnosis of liposarcoma is the identification of variable numbers of lipoblasts, which may be univacuolated or multivacuolated. The vacuoles represent fat in the cytoplasm. 4 major histological varieties of liposarcomas are: the first one is well differentiated liposarcoma. It resembles a lipoma but contains uni or multivacuolated lipoblasts. The second one is myxoid liposarcoma. It is composed of monomorphic fusiform or stellate cells lying dispersed in mucopolysaccharide rich ground substance. Occasional tumor giant cells may be present. Prominent meshwork of capillaries forming chicken wire pattern is a conspicuous feature. The third one is round cell liposarcoma. It is composed of uniform round to oval cells having fine multivacuolated cytoplasm with central hyperchromatic nuclei. It may resemble a signet ring carcinoma, but mucin stain helps in distinguishing the two. Pleomorphic liposarcoma. These are highly differentiated and the most anaplastic type. There are numerous large tumor giant cells and bizarre lipoblasts.